Hi, I'm Mike McCormick, live at GBTA Studios here in Toronto, and I'm here with Michael Szabo, Medical Director of Novus Health, and Robin Engel, the CEO of MSH International Americas. Thank you both for being here, and thank you for giving the session you gave this morning. Certainly a very hot topic about cannabis and international travel and the intersection of all of that. And for our audience here, very important information, certainly for Canada, the country that's in the process of legalizing marijuana, states in the US that are as well, changing views on cannabis in general. A lot to talk about. How did the session go, and what were some of the key takeaways?
We had a great turnout. There was a lot of people in the audience, even suppliers that were talking about the HR side.
Right.
Human resources is a big thing now because they have to create policies. They have to make sure that their traveling staff understand the rules. They've got liability issues.
Right.
Michael was talking about the medical effects of marijuana and cannabis.
Yeah, I think it's a topic that everyone's really interested in. I think there's a lot of mythology around cannabis, and I think people are always hungry to learn more about it.
Right.
And I think particularly, people want that kind of unbiased information about it, because I feel like it's a very polarizing topic, and I think that on either extreme is really difficult to really understand and know about this substance. I think you have to have somebody explaining, the pros and the cons, and the pluses and the minuses, and the risks.
Right.
Because there's a lot of benefit to cannabis, but there's a lot of risk as well, and you need to understand and be informed.
Right.
What was interesting is at the end of the presentation, we had a Q&A, and after the Q&A, people came up and talked about their personal stories, about their kids, about relatives,
right.
And what about misdemeanors, or when they had problems, would they get caught at the border going into the US, or when they're on an air flight?
Right.
So it was interesting, it brought up other subjects out of that.
Yeah, I would say, and I think, it like you said, it's something that I think connects to everyone. And then as employers, you have a whole different set of issues, because legalities aside, you still have the need to set policy for your company that makes sense too, and that's relevant and protects your company in a way, like you said, back to a liability, perspective, worker productivity, et cetera, right? Those are all real issues that we're facing.
A lot of the hospitality industry,
right.
Transportation industry, is having to create policies now that they didn't have before because they were lumped in with intoxication or drugs.
Right.
Now they actually are dealing with a legal issue, and they're dealing with a liability issue, and a productivity, like you said.
Right. A lot to balance.
Yeah.
And then as it relates to travel, basically giving good information to their travelers about really the fact that, there's just the restrictions that were there before still exist today.
Exactly.
Also, coming into Canada, you can't bring marijuana into Canada, even if you're a Canadian and it's legal on the other side.
Right.
You can't.
Yeah.
So
Right.
coming across Canadian border services, it's not allowed. Going across to the US, it's not allowed. If you have a plane flight diverted because of a problem, and because most Canadians are along the 49th parallel, there are a lot of plane flights that are going between cities that if they had a problem, they'll land in the US. You could have an issue. So even if it's legal.
Right. It may not be.
Yeah.
There are even synthetic cannabinoids that people are taking that are prescribed by a physician. They look like normal pharmaceuticals in a pill bottle. And people don't realize that actually they can have trouble traveling across borders with even those. Even though it has all the information on the bottle and it looks like a pharmaceutical, it's still a cannabis containing substance, synthetic, but still. So those little sort of details people need to really comprehend and understand, I think.
Well, and I think also all the border officials, both the U.S. and Canadian governments and others, they're still grappling with even how to enforce.
How to manage it, yeah.
And how far to take enforcement on some.
We also talked about insurance policies, so travel insurance. It's an area I know very well for the last 42 years. We do travel insurance around the world. The limitations and exclusions are still there if you're intoxicated.
Right.
So if you get into trouble and you've overused, even if it's legal, so it's alcohol or marijuana, cannabis, you've got a problem.
You still have a problem.
Yeah.
Well, interesting stuff, interesting times as always, right? But again, points to the value of having accurate, up-to-date information, regardless.
People
right?
need to have access to the right health information in this day and age. With all this stuff on the internet, they need someone to really help them understand and be balanced and present them unbiased information.
To avoid the fake news.
Right.
Exactly.
Right.
No fake news.
Right. Well, and again, we've gone, certainly in our working careers, we've gone from, not having no information or not very little to having an abundance of, that you have to call through, right, to get to the.
I got to give credit. I got to give credit to GBTA though, because the organization has actually taken on this issue. I know in Canada they have.
Yes.
And they've talked about it with the employer groups, and it's been a mystery for employer groups.
Yes.
There hasn't been a lot of government information.
No.
So it was great that the association got together and did something.
Well, and we're going to continue to.
Yeah.
Because, again, the buyers in our community, they're faced with this among many issues, right?
Right.
But they're right at the epicenter of these, and they're expected to know and really advise their companies intelligently and have input into those policies, and they can't do that without great expert advice.
Right.
So thank you both for being
Thank
here
you.
and
My pleasure.
participating. We appreciate your support as well.
Okay, thank you.
Pleasure.
I'm Mike McCormick, live from GBTA Studios here in Toronto.